Too bad it's a hopeless cause. Senator Bernie Sanders has turned a key plank of his quixotic presidential campaign into new legislation meant to expand health care coverage to all Americans. It's a bold idea that addresses a genuine problem, which is why liberal Democrats such as Senators Elizabeth Warren and Kamala Harris back the idea. But Sanders et. Alabama are aiming for the impossible when something more plausible could accomplish the same thing. The Sanders model is single-payer. The government would pay for everything. It would lead to universal coverage, which means everybody would have insurance. But single-payer and universal coverage are not the same thing, and it's possible to have universal coverage without the government running everything. Sanders rightly points out that every other developed country has universal coverage for its citizens. Even President Donald Trump has said he'd like to see insurance for everybody. But that doesn't mean a giant government program is the only way to do it. The worst part of the U.S. healthcare system involves people who don't get coverage from an employer and don't qualify for Medicare or Medicaid. The 2010 Affordable Care Act addressed that problem by subsidizing insurance premiums for lower-income people and expanding Medicaid. But there are still roughly 28 million adult Americans with no insurance, many who simply find it too expensive. A couple million more don't qualify for subsidies and pay exorbitant premiums to buy coverage in the individual insurance market. This is where any effort to achieve universal coverage needs to begin. Sanders argues that all Americans need to be in the same insurance pool, Medicare, for the government to negotiate the best prices. But there are already 44 million people in Medicare, and 62 million in Medicaid, making them both giant insurance pools. Switzerland boasts lower costs and better health outcomes than the U.S., with a total population of just 8.5 million. Medicare is more bound by laws that limit its bargaining power on prescription drug prices, for example, than by lack of heft. Even a hybrid system of universal coverage would be politically difficult to pull off. Critics worry that any effort to expand the government's role in healthcare could inevitably lead to a single-payer system, so there would need to be safeguards meant to keep the employer-sponsored system in place. Medicare is due to start running short of money in 2029, and anything that adds to its financial burden will hasten that day of reckoning. Finally, voters usually dislike change, so they'd have to be thoroughly sold on Medicare for more to pressure Congress to give it a shot. But Medicare for All might be a start. Confidential tip line, Rick Newman at News Pulse. Encrypted communication available. Rick Newman is the author of 4 books, including Rebounders, How Winners Pivot from Setback to Success. Follow him on Twitter, @RickNewman.